I know we're going a little longer than we normally do, but this is important stuff, and we have a lot of people who are trying to accommodate. And I appreciate Vang Ingram from the Office of Drug Control Policy being so patient, and also Mickey Hatmaker, President, and Tommy Lovin, Kentucky Narcotics Association. All you guys want to come up together, maybe? It's always good to see the sheriff from Owensboro. Sheriff, feel free to come up too. You're one of my heroes. Feel free. Okay, because I know you may have some wisdom. I know you have a lot of wisdom on this subject, and it's great to see you, man. Thank you for being so very patient, and introduce yourselves for the record and proceed with your testimony.
Tommy Loving. I'm Executive Director of Kentucky Narcotic Officers Association and the Director of the Bowling Green Warren County Drug Task Force. I'm going to pass it over to President Hatmaker and available for questions at the end.
My name is Mickey Hatmaker. I'm President of the Kentucky Narcotics Officers Association.
My name is Van Ingram. I'm Executive Director of the Kentucky Office of Drug Control Policy.
Mr. Chairman, I have a prepared speech that'll last about 5 minutes, but before I do, I'd like to publicly thank Representative Simpson for his comments about the Dallas shooting. Our hearts and prayers goes out to those folks. We appreciate your empathy. Chairman Schickel, just take about 5 minutes, Mr. Chairman. Chairman Schickel, members of the committee, my name is Mickey Hatmaker. I'm President of the Kentucky Narcotics Officers Association. I would like to thank you for the opportunity to express our concerns surrounding the legalization of cannabis for medical purposes in our Commonwealth. We represent approximately 400 narcotics officers from virtually every law enforcement agency in the Commonwealth. Our men and women are on the front lines of the drug epidemic that has plagued our Commonwealth, and they see firsthand the destruction that illicit drugs have caused in our communities, the citizens we are sworn to protect, and yes, even our families and friends. We are in the midst of the drug problem that continues to claim the lives of Kentuckians every week. I feel comfortable that we can all agree that our Commonwealth is facing serious issues surrounding these problems. We in law enforcement, along with our partners in prevention and treatment, are struggling to keep pace. We are underfunded and overworked, but are earnestly committed to making our communities as safe and as drug-free as possible. With that being said, this committee is convened to hear testimony as whether Kentucky should expand its access to cannabis for medical purposes. 25 other states have done this either by ballot referendum or legislative intent, and contrary to the process by which all other drugs have been tested and approved. All drugs intended for human consumption are required to have been tested and approved by the Food and Drug Administration. The concept of cannabis as medicine began in California in 1996, when they allowed access to crude cannabis either smoked or ingested to treat terminally ill patients and those who suffer from debilitating diseases. California soon found out that less than 3%, I'll say that number again, less than 3% of the compassionate card holders actually fit the criteria of Prop 215. Each subsequent state that has sought to legalize marijuana for medical purposes has stated that they should have done a better job regulating access to cannabis by limiting it only to those patients who suffer from debilitating disease and illnesses. If we look at the latest Substance Abuse and Mental Health Services Administration, SAMHSA, 2013-2014 National Survey on Drug Use and Health, it is very clear that in the states where cannabis has been legalized for medical purposes, marijuana use by 12 to 17-year-olds is the highest. In fact, 23 of the 25 states are states that have legalized cannabis, and in many instances, these statistics are nearly double the national average. This in and of itself is alarming, but when you look at the usage rates for 18 to 25 years old and 26 and above, the same holds true. Our children and young adults are using cannabis at alarming rates. They now have access to marijuana with THC concentration exceeding 30%, as well as infused edibles and concentrates with THC in excess of 90%, all of which are readily available in states which have medicalized cannabis. This will have detrimental consequences that we are not able yet to ascertain. All research on the harms of THC to the developing brain has been conducted utilizing THC concentrations of 12 to 15%. So we have no idea what today's cannabis potency levels are doing to our children and young adults. As a retired state trooper with over 20 years of drug law enforcement experience, I've arrested numerous murderers, rapists, burglars, and drug traffickers. And almost everyone that I arrested was under the influence of drugs at the time. The vast majority stated that their initial encounter with drugs was experimenting with marijuana in high school. Ask our colleagues in the prevention and treatment arena, and they will tell you the same. Outside of alcohol and tobacco, this is a gateway drug that leads our children and young adults down the road to illicit drug use and addiction. I, along with the leadership of the KNOA, sympathize with those who are suffering debilitating diseases and those who are terminally ill. We do feel that there may be some cannabinoids contained within cannabis that may possess medical value. GW Pharmaceuticals has two products that are direct compounds from the cannabis plants, both of which are in FDA Phase 4 clinical trial and showing promise. The KNOA is encouraged by the introduction of the Marijuana Effective Drug Studies Act of 2016, or MEDS Act. This bipartisan legislation for legitimate medical marijuana research introduced last month will make it easier for research on the medical effectiveness and safety of marijuana's components. The KNOA joins the American Medical Association, the American Academy of Pediatrics, the American Cancer Society, the American Society of Addiction Medicine, American Prevention Medical Association, American Pain Society, American Society of Anesthesiologists, and the American Academy of Pain Medicine in support of the MEDS Act. In spite of the best intentions of these 25 states, raw marijuana, either smoked or ingested, is not medicine and has never been passed through the rigorous FDA approval process to ensure health and safety of patients. The KNOA believes that medications, including marijuana-based drugs, should go through the scientific process and should be accessed through legitimate physicians. Thank you for the opportunity to express our grave reservations about expanded access to cannabis under the guise of medicine, because ultimately it will be our children that will suffer. With that, we'll take your questions.
Thank you for your testimony. And what I'd like to do is now is, and then we'll do questions for the whole panel. Van, do you want to go ahead and proceed with your testimony now?
Thank you,
I know
Mr.
you've been
Chairman.
waiting a long time, and I appreciate you being here.
Thank you, Mr. Chairman, members of the committee. Glad to be here today. I want to thank you for such a well-balanced hearing. I think this is an important policy issue. It's not going away. It's something our state's going to be dealing with for some time. And I really appreciate the balanced approach and the different speakers you've had. I would encourage you, as this issue moves forward, there's other people you need to hear from. You need to hear from our substance abuse treatment community, because they're on the front lines dealing with folks with substance use disorders every day and have insights into this problem, into marijuana. Our prevention specialists. You heard Mickey talk about 23 of the 25 highest states for teen use are medical marijuana states. That's going to happen here. It's happened everywhere that's passed medical marijuana. Now, is that, there's risk and rewards to all medications, and clearly from Dr. Barnes's testimony, there is some medical benefit to marijuana. But like all medications, there are risks, and those risks have not been, in previous hearings that I've heard in front of the General Assembly, those risks have not been explored. We've only talked about the benefits. And although there are folks that will come testify about the positive experiences they have with marijuana, I can also fill the room with people who have had negative experiences with marijuana. Those folks need to be heard from as well. Our University of Kentucky Center for Drug and Alcohol Research is known nationally for their work on substance use disorders and research into drug addiction and alcoholism. I would encourage you to hear from them, because they've done a number of studies on marijuana and its effect on the brain. So as this thing moves forward, I encourage you to hear from more folks. There are risks that we're going to have to consider. But if this moves forward, the National Federation of State Medical Boards recently came out with, for doctors recommending marijuana, their guidelines. And they were very, very good guidelines. I believe I provided that to staff. If not, I will. I would encourage you to take a look at those and think about those if drafting occurs utilizing these recommendations. Senator McGarvey talked about a strict definition of debilitating medical conditions, and I would certainly encourage that. the fact is, in most of the states that have tried to do the right thing and have a compassionate marijuana bill, they've still ended up with 18 to 34-year-old white males with obscure conditions being the majority of the cardholders. For physicians that are going to be recommending marijuana, they need some specialized training and a special license. You know, we've seen this in Kentucky before. A very small number of physicians can cause a lot of problems. We've seen prescribers that kind of chase the business model of the day. Although they're very small in number, they can cause a lot of problems. We certainly need an agency to regulate this that's familiar with regulations and familiar with how to regulate something. I don't think public health is necessarily the right place for that. And certainly we need law enforcement background checks on all the people that are involved. Ohio did something a few weeks ago that I think would be very important in a bill for Kentucky, and that is they're requiring their dispensers to report to their prescription monitoring program. Also, the physicians that are recommending marijuana are required to query their prescription monitoring program. A physician can't make a good clinical decision about whether or not to offer someone marijuana or recommend marijuana if they don't know what other controlled substances that individual has been prescribed in the past or maybe currently on. Finally, what a medical marijuana bill should not contain, I believe, is the ability for folks to grow their own medicine. We have a problem with drug diversion in this state as it is. We have a lot of folks that live at the poverty level or below. The temptations to grow your own and then sell what you don't need are going to be really great, and that's understandable. We don't need, if you talk to kids in Kentucky and say, what, is it easy to get marijuana? They'll certainly tell you it is. We don't need it to be any easier. And we don't need people growing it in their backyard where their neighbor's kid can come steal it out of the backyard. So those are some of my cautions moving forward. This is a big policy issue for states to decide what's medicine and what's not. And I know 25 of them have gone down that road, but I think it requires a lot of careful deliberation.
Thank you for your testimony, and you're exactly right. This is a big thing, and that's exactly why we're here today, spending 2 hours on it during the interim. Are there any questions? I would like to remind the members that there's numerous groups that wanted to appear before us today, and because the agenda was so full, they could not do it. Many of those people have statements in your packet. I know the family physicians and the Kentucky Hospice Association, Brian Jones is here on the front row. Dr. Brian Jones, the director of St. Elizabeth Hospice in Northern Kentucky, and many other guests are with us today. Then the sheriff of Daviess County. I really wish we could have had time to take your testimony because you're certainly, I feel, one of the experts on this. But I think we've had a really good hearing here today, and I appreciate the members' patience. And if there's nothing else to come before this committee, we stand adjourned. Committee adjourned. Thanks.
Yeah.